just before the welcome address, we were
News Balance Media and Communication has called on government and key stakeholders in health sector to prioritize maternal nutrition, stressing that poor nutrition remains major problem health challenges in Nigeria and globally. This call was made by team lead Bukola Afeni during the 5th anniversary of News Balance Media and Communication held in Abuja. The event brought together stakeholders who deliberated on the challenges of malnutrition in Nigeria and explored sustainable pathways forward. Afeni explained that the nutrition conference focused on evidence-based approaches to improving maternal nutrition, strengthening multi-sector partnership, scaling nutrition intervention in material setting, and advancing advocacy and policy recommendations to ensure nutrition is prioritized in national health planning. According to her, Nigeria faces an alarming burden of undernutrition among women. The statistics, she said, are stark. An estimated 7.3 million adolescent girls and women of reproductive age in Nigeria are undernutrition, increased health risk for mothers and their newborns. She noted that Nigeria's maternal mortality rate remains one of the highest globally, with 1,047 deaths per 100,000 live births, adding that micronutrition deficiencies significantly contribute to the burden. Poor maternal nutrition is associated with low birth weight and an increased risk of childhood undernutrition. This condition can limit a child's growth, cognitive development, and future productivity. As part of effort to address these challenges, Afeni said the organization, in partnership with Health Communications and Visible, has visited 2 internally displaced persons IDP camps in Abuja, where direct maternal and child nutrition support was delivered. He emphasized that maternal nutrition is fundamental for healthy pregnancies and thriving children. Speaking on the role of culture in malnutrition, Judith Ogudu, program manager at NOIPOS, said harmful cultural beliefs continues to influence what women eat or do during pregnancy, hereby contributing to malnutrition. According to her, change begins at the individual level, but the approach to communications determines whether change is sustained. She highlighted the critical role of media in working closely with community leaders to ensure nutrition messages are credible and accepted at the grassroots. Ogudu also emphasized the importance of early education, noting that young people are constantly exposed to junk food advertising without adequate nutrition guidance.
Begin with research we have done in recent times, and I'll start with, like we have mentioned, nutrition spans across the whole circle, the whole human circle, right? And if I focus on maternal, from periconception, if I did a survey now in this room and asked the ladies in the room, how many of us are aware that we're supposed to be taking iron folates prior to even getting pregnant? Prior to getting pregnant, I'm pretty sure that maybe half of the room will say no. And so one of the research we conducted, we were asking women, because NY Polls focus is on getting data to support decision making. I can come and say nutrition is a problem. The way you have thought the FMOH is not doing enough, is just paperwork. But you see that with Madam's convictions, it's not just the paper, but it's nicer when you have a 50%, a 20%, a number to back that. And that's what we do at NY Polls. Now, our research, we were asking mothers, women who had delivered within the last 2 years, how much were you aware that you were supposed to take iron folates? And many of them did not know. Across states, and it was worse off in the north. I do not think that there was a state in the north that got to 50%. And it was really worrisome. And then among those who were even aware of the iron folate during pregnancy, probably through the ANC platform, many of them did not adhere. So it's one thing to actually say, this is what to do. Because all these guidelines that madams have spoken about are actually there. They're healthcare workers breaking their backs, ensuring that these women are getting the information. But the women, me and you, we are the problem sometimes. They will give you drugs to take it every day. We had women saying, oh, it smells too much. I don't like how it tastes. is not sweet. It's supposed to be something to help you and your baby. So the concern now became, what exactly is the gap? Is it that the information, they're not understanding how big the problem that can come of not taking those tablets can be, right? And then is there something we need to now do to how our ANC platforms are delivering this information to the women? And then the Nutrition Society has done a lot through communication, right? And even the media, because some women got their information via social media. And of course, you will know that those few are the educated ones who have access to a telephone or who have access to data. So they must have had some of agency. So research shows that a lot of women who are not even adherent, so the first thing is awareness, they're not even aware. For those who are aware, in states or in peri-urban areas, they are not even adhering to the instructions they are giving about this micronutrient supplement or the iron folic acid acid. And even when you explain to them, these are the things you should eat. Mara mentioned something about some of them preferring to drink Coke, preferring to eat. They'll rather have that than have vegetables. So some of all these things are things we have seen, and of course we have communicated with partners, because it helps them guide how they plan their interventions at the community level. It also helps them guide how to plan interventions at state level, because sometimes you might think what is happening in Lagos is same thing happening in Kano, and if you use the same approach, you may not be able to get the same results. I can go to a Lagos state and use WhatsApp and probably get the desired result. But if I try that in a Kano, trust me, I might be talking to myself. So the information and data we generate is able to help them form their interventions to suit whatever communities or states that they find themselves. Other side. And you're now a potential danger to everybody, because we're now having to think of, you can get diabetic, you can have any of the cardiovascular diseases as they come. You are now a risk to even yourself, and then what's of your child. So some of these things, I know that there is a state in Nigeria, I'm going to be keeping state names away, that when you give birth, they take you into a special room, you do absolutely nothing. So just think of sedentary lifestyle that one is going to live for the next 30 days. Doing absolutely nothing, eating. And they are very proud about it. If they don't do it for you, you are like the one whose family is accursed and you're not rich about behavioral change. If the individual does not decide to take that change, nothing's going to change.
With these policies that are listed, like this National Micronutrient Deficiency Control Guideline, what does that the guideline entail? It entails tracking widespread deficiency, like in vitamin A deficiency, iron deficiency, iodine deficiency. This document, we go down to the facilities, we ensure that health workers get the right training, so that there's a meeting I went for. We're told that in that state, they are the highest producers of beans. But what happens? The farmer sells all the beans. Oh. And when coming home, he buys milk and bread for the children. Yes. These are documented. So what is the ministry doing? With this kind of guideline, we go down to train, to monitor, to supervise, and we put in all our policies, the guidelines in place to ensure that micronutrient deficiency is actually under control. The media needs to engage much with the traditional rulers, the religious leaders, the chiefs, and the people. You say that if you go to a community now, you want to talk or you want to reach that community. If there are some persons in that community that the people listening to. So in anything you want to do, please use the right approach of reaching out to the important persons in those communities. The current state of maternal nutrition in Nigeria is serious, and there's actually a problem, I'm not denying that. More than half women are anemic, up to 58%. Millions of women and girls are undernourished. Many lack adequate diet diversity, and service coverage for micronutrient support remain far from universal. If you see the situation, the insecurity, food insecurity, is a big problem. A lot of people have lost their jobs, source of livelihood, to the insecurity. Can we start addressing from there? Can we support the government to ensure that Nigeria become a very safe place for us?
150,000 copies nationwide. As we speak today, no newspaper circulates 50,000 or 40,000 nationwide. Most of them do Abuja, Lagos. Then the little ones that will go to some states will not get more than 200 copies of a newspaper. So what are we talking about? Communicating. The last time the Guild of Editors met with the president, one of the issues that was actually mentioned was the need for fiscal incentives. The newspapers are dying. The radio stations, televisions are going through a lot of fiscal pressures. And unfortunately, social media has come to become a bastardized chapter of journalism. Am I right, Mama?
No.
Social media can put the head of a goat and put it in a hen and tell you that's a hen. If you believe 30% of what goes on in social media, you may be in trouble. So the traditional media houses, television, radio, and all the rest of them that we have mentioned, they need to localize some of our contents to get to the grassroots. For instance, if I want to talk to people in Mama's village, I can, if I use the local dialect to push that message across, it will be 20-30% more impactful than speaking grammar. But how do I get to that place? I need money. How do we get the media to play these roles? Very important and fundamental. There should be some support from the government in terms of fiscal incentives. If you know how much percentage we pay as duty on newsprint, you hold your head like this. And they are not selling. Papers are not going anywhere apart from Abuja, Port Harcourt, Lagos. That's all. In Kano now, I'm not too sure if there is any paper that is sending 500 copies to Kano. So, for us, this is a chapter that should really bother us, and unfortunately, none of us can actually push some of these things to where they needed to get to. But I'm sure journalists will report, and some will still read about what we're discussing today. It is a big challenge, and I pray God Almighty will help Nigeria.
The economic status of mothers, even families, is very, very challenging. A family of 5 is only the father that is working. The mother sits at home and does nothing. Definitely, how are they going to feed their children? It's very, very challenging. Number 2 is the way parents or the mother, I talk about poverty, then food insecurity, trimester, second trimester, and all the rest. Because they are not attending antenatal clinic. So it's a very big challenge for them to know what and what to eat at that particular point in time. So they are malnourished, they are not getting adequate nutrients during the pregnancy because they need to eat for their own health to be healthy. Likewise, for that unborn child